Hi guys, welcome back to Medical Coder Life. Today we're continuing our series on physician documentation, and we're talking about the history and physical. Now, the purpose of the history and physical examination is to document the health status of the patient at the current time with signs that might aid the practitioner in predicting a diagnosis of the illness or predicting the outcome of the patient's care, or both. It's the starting point. It's when the patient first went into the physician's office, and based on the patient's diagnoses, the physician felt that better care could be rendered to this patient in the inpatient setting. So again, the history and physical is that first form. I call it chapter 1 of my book that I'm reading, because this is my starting point. This gives me a current status of the patient today. Okay? What does the physician see that is wrong with the patient today that he feels justifies admitting the patient into the hospital? Now, remember, any form in the medical record starts with the identification information, such as the patient's name, their medical record number, their date of birth, their attending physician, whatever would specifically identify this Jane Doe from this Jane Doe. What personal information would help me to identify the difference between the two so that I can keep the two with the same name? I know what makes this Jane Doe number 1 and this Jane Doe number 2. So we start with our identifying information. And then the first paragraph is the history of the present illness. This history of present illness discusses what medical problems patient is currently encountering. What reason did the physician feel justified admitting the patient in? Why couldn't it have been treated on an outpatient basis? What was the need to admit this patient into the hospital for care? And from the history of present illness, we go into past medical history to include any surgical histories. It's a summation of the patient's past medical problems that they may have encountered, or any past surgeries that they may have had. Again, this is the next paragraph in your history and physical. Then your physician also discusses any allergies the patient might have, just to make sure that while patient is in-house, we don't make the mistake, and when I say in-house, I mean in the hospital, we don't make the mistake of feeding the wrong foods or administering the wrong medications. And straight from there, the physician will also start stating what kind of medications the patient may be on. And this can be by prescription and by over-the-counter, any kind of medications. So it's a listing of all medications, because we want to know, are these medications causing problems? Or could they interact with any new medications that the physician may prescribe? Okay. What about the social history? Social history. Social history encounters the education of your patient, their occupation. Could it be causing some medical problems? Their marital status. What about alcohol? Does this patient drink alcohol? Do they smoke? Do they do drugs? What about their sexual activity? Could any of these play a role in what's going on with your patient? That's the social history. The physician will also look at the family history. Tell me a little bit more about your family. What's the age of your parents? And if they're deceased, what caused their death? Or any siblings, any other family diseases that may be going on in your family. And then he'll do a review of systems. And with that review of systems, he'll list each body system and talk about what's going on with his patient when it comes to that body system. And with the history and physical, the goal is for the provider to come up with the diagnoses and to begin to develop a treatment plan. So again, I always say your history and physical is chapter 1 of that whole inpatient chart. Now, as far as timeliness, the history and physical must be completed within 24 hours of admission. Let me say that again, because this is one of the things that we always look for in an inpatient chart. The history and physical must be completed within 24 hours of admission. However, if we admit this patient today and they need surgery today, that history and physical must be on the chart before surgery. And a complete history and physical may be completed up to 7 days before admission, with the understanding that that physician must attest, he must sign off on that history and physical that morning of admission. So if he sees you in the office today and says, okay, we need to get you in the hospital, and the patient might say, well, I've got some family members I need to make arrangements for at home. Let me go home for a day or two, and then I'll go and admit myself to the hospital in 2 days. Well, your physician can go ahead and dictate your history and physical and send it over to the hospital along with his admission order, his order that states that he wants you admitted, so that when you come in, it's there. But the morning that you come in, he has to come in and sign off that he saw you. And he agrees that the history and physical is what's currently going on. Another reason I like the timeliness of the history and physical is because now a lot of coders do what's considered concurrent coding. In your larger facilities, retrospective coding is when the chart is complete. You just go in, you read the chart, and you do the coding there. But concurrent coding is when daily a coder will go up to the floor and start auditing, start reviewing the chart and working up a diagnosis so that we can communicate with the physician while the patient is in house to make sure the documentation needs that we need are there. So again, timeliness of an H&P plays a very vital role in physician documentation. All right, so I hope I've explained exactly what a history and physical is. On my other channel, Codemaster Coach, I'm doing a series on CPT E&M coding, and I actually covered history and examination when it comes to the E&M, because that's one of the two of the key components of an E&M code, history and examination. And notice as I discussed the history and physical form in this video, I talked about social history, family history, past medical history, history of present illness. All of these, this is the form that you will find those levels of history and exam to determine your CPT code. So this history and physical form plays a very vital role in physician documentation. And because you know the timeliness that's required of it, 24 hours of admission or within before surgery. If surgery is that day, you can't wait. You've got to have the history and physical on the chart before surgery. Because we know the timeliness of it, because we know what's required of a history and physical, it will make us a better coder. All right, guys, that's it for history and physical with physician documentation. Thanks. I'll see you in the next video.